I think నేను రాకముందు పోస్ట్ చేసుంటారు. సో
Yep. Hello, everyone. This is Raj, doctor of physical therapy, and physical therapist Swati Balanthropu is with me today. So Ryan Perron is on vacation, so he's unable to join for this session. He'll be here next for the next session. So we have been having some technical issues. Thanks for patience, your patience. We are trying our best to learn the technology. There's so much to learn, and we are doing our best to learn and improve our presentation skills. So we have been addressing questions on this live sessions. Um, Previously, we talked about frozen shoulder. We talked about peripheral neuropathy. In this session, we are going to answer a few questions that came up. One of the quorum members asked me, how can I reduce my muscle tightness and improve flexibility? Swati, do you want to go ahead and answer that,
sure,
please?
sure. Yeah. Hello, everybody.
Thank you.
This is Swati again. So yes, that's a great question. Most of us are tight, and that's because of the lifestyle that we live in. We tend to sit in one chair and like not move around. So inactivity makes us more tight every day. So make sure you're doing some meditation, yoga, to relax your muscles, and also like simple basic stretches you might be able to do, like both for your upper and lower body. So start like with maybe 3 or 4 basic stretches, like biceps, just your arms, and then maybe one for your upper body, like your chest, and then maybe one for the neck. And make sure you're doing these stretches to begin with, like 5 to 10 seconds hold, and then slowly increase the number of seconds you're going to hold to improve the efficiency of the stretch. And small stretches add up, and over time you can increase maybe like 4 stretches for the upper body, and then start with the lower body also, and work your way up, so you're feeling that effect of the stretch and feel more relaxed. And you can actually feel it sore the first few days because you probably are not used to it, but slowly you will see the benefits of stretching, where you feel more flexible. You feel more relaxed overall. Yeah.
Okay, that's great. Thank you, Swati.
Mhm.
Um, so another question was, what are the best exercises for improving posture? Um, so posture can be, you know, it depends on what are the postural abnormalities. There can be a scoliosis, there can be kyphosis, there can be lordosis, depending on what part of the spine the deficits are. So it's really, to generalize it, it's kind of hard, but in general, I tell my patients, with any back or spinal issues, I have them stand against the wall. So stand with back against the wall and try to touch their head to the wall. So if you have postural issues, most likely you're not going to be able to touch your head to the wall. Especially if you're looking at the whole body posture, then you have to, take a few steps back and touch your ankles or heels to the wall, at the same time touch your head to the wall. If you did that, probably you don't have any fixed abnormalities. If you do have fixed abnormalities, you won't be able to touch your head and heel at the same time to the wall. And if you there is another condition where your deformity can be flexible. So when you stand without any support, you may be bent. You may have some kyphosis or lordosis, but when you stand against the wall, you will be able to stand. In that's when you have to work on core strengthening, um, if you, especially, I recommend swimming, because when you swim, you are moving your spine and arms, major big muscles, legs, and everything you're moving, especially with postural abnormalities. Unless it is a spinal stenosis, I don't recommend swimming, because in swimming, your spine goes into extension, which is not recommended for stenosis. Otherwise, most people should be able to swim if no spinal, stenosis. So that's one thing I recommend, and also standing against the wall and try to, maintain erect posture. So those are the keys. And if you have structural deformity, that you have to see a physical therapist. You can treat it by yourself. Even a physical therapist may not be able to help you fully, unless you go through some, correction procedures. So it may be orthotics, it may be surgery. So based on what your abnormality is, it's a teamwork. It's a doctor and therapist, and you know um, all the specialists come together and help you. If it is a flexible deformity, you should be able to, improve your exercise and fix the problem on your own, literally. If it is hard for you, then you have to see a physical therapist. And Swati, this is for you.
Mhm.
How can I reduce my risk of injury during exercise?
Great question. So, usually we recommend at least 5 to 10 minutes of warm up to begin with before you do any exercise, be it cardio, be it strengthening, or any kind of exercise that you're doing. So make sure you're warming up, getting that heart rate up, and slow movements. So you're preparing yourself to the actual exercise that you're going to do, be it cardio or strengthening. And then also remember to work on some stretching exercise, again going back to the previous question, right? So you can include some of the cool down and stretches at the end of the session. Again, 5 to 10 minutes at least, and take your time. I know people don't have time to exercise, and if they do, they just want to quickly get the benefit of exercise. But then it's important that you reduce your chances of injury by actually putting time into warm up and nice cool down periods, at least for 5 to 10 minutes.
All right, great, thank you. And one of the questions that came up was, somebody was asking, I'm not able to get up from the floor because of the knee pain. So they have knee pain and they are not able to stand up from the floor. What do you recommend, Swati?
So I think it's a process. If you want to really, help yourself getting up from the floor, you need to be, first work on some of the functional exercises. So I would say instead of going down directly onto the floor, work on your thigh muscles to get stronger. So to begin with, you can start with simple sit to stands where you're sitting in a chair and standing up. You can start using your hands to begin with. Take weight on your hands and then slowly start standing up, not as much weight but letting your legs do the work, and then slowly getting your hands off of the armrest and let your legs do more of that work. And as you progress, you're completely letting the hands off and let the legs do the work, and then progress to like doing kneeling and trying to stand up, doing half kneeling where you put one foot on the floor, one knee on the ground, and trying to stand up. So there are like progressive exercises that you can do to help strengthen your legs first, because you need to have that leg strength in order to get up from the floor, and it's against gravity. So you need to develop that strength, and it takes at least a few months in order to do that, especially when you're not very active, or if you had like a fall or some kind of injury, and that's when everything started going down, you definitely need to work on the functional exercises, like standing up from the chair, and kneeling, and those kind of things.
Yeah, in the previous video where Ryan and I, talked about, so I explained them, similarly what you're saying, functional exercise, but I was suggesting them to, I think it's the same you said, start with a higher surface and gradually go down, use a lower surface or step stool, after that squatting completely, bringing buttocks to the heels, that's full squat.
Mm-hmm.
So those are the things, progressively, lowering yourself to the ground. That would be, better strengthening for knees,
Yeah.
but it will be painful. You have to be careful
Mm-hmm.
and consult with a physical therapist if you have any questions. And Swati, in our talk today, you mentioned you are a Tai Chi instructor. So
Yes.
in balance, we talked about balance in the first video, but we didn't really come up with anything interesting. So could you maybe elaborate on what is Tai Chi and how Tai Chi will help balance,
Yes.
uh, balance issues.
Yeah. So Tai Chi. So I am a Tai Chi instructor, and I got my certification from Tai Chi Kuan Movement for Better Balance. So this is an evidence-based program that I got certified in. So in this program, what we essentially do is we do a lot of breath work along with challenging your balance. So we take one position. Say, for example, we do standing up, and we do weight shifts along with breathing in and breathing out. So everything that you're doing is associated with breathing in and coming back to the neutral position again, breathing out. So we have over 8 forms of Tai Chi. It's called Tai Chi forms. We have total 8 forms, and it goes from like very basic carrying the ball kind of movement to very progressive levels of forms. So it gets intense as you go to form 6, 7, 8. And we work on each form like about 2 weeks, and then progressively increase it to the next form. And all of these involve increasing the base of support to begin with, and then slowly we decrease the base of support. And then we have tandem stands where we have like the foot and the heel and the toes, back to back in some of the forms. And in other forms we have like dynamic movements where it's more challenging, but everything is done slowly and no rotational movements are involved. It's very relaxing if you pay attention to your breath work, and if you really do it slowly. You do not want to injure yourself doing any of these movements, so you have to take it super slow. Work with a Tai Chi instructor if you have anybody nearby. Try not to do on your own without knowing how to do some of these forms, because it can cause pain if you don't do it right. And a lot of them are just doing with breath work and very slow movements. So anytime if the students interpret as like quick movements, that's when all the problems come. In fact, when I was training for myself, the first 3 days I was very sore on the back because I did not pay attention to some of the nuances that we have. So it's important, just like yoga, right? You need to really understand how each of those forms work.
Right. You
Yeah.
brought up a good, you almost touched my thought process because I was thinking, how is Tai Chi different from yoga? Like, I know yoga is more about postures and holding the postures for
Hmm.
longer periods. And I took one class. It was mandatory for us to take in school,
Yeah.
physical therapy school. I had one class where, I mean, it was not even course. It was just one day.
Mm-hmm.
and our class where the instructor came and he wanted us to feel the some sort of a circular movement.
Yeah.
He made us do very slowly, and yeah, so there's a lot of emotions involved with it. They keep telling you, instructing you how to feel and things, right?
Yeah, yeah,
So
yeah. So
how
each
is it different from yoga? Like,
Yeah, so each form you take it very slowly. So, say for example, carrying the ball, right? I'll just give you one example. So, you
sure.
carry the ball very slowly on one side, and before you get to the neutral position, you want to take the breath very slowly and then come back to neutral, breathing out. And again, you do the same movement on the opposite side. So, it's like you mimic breath and the movement together. So you don't hold any form per se, but you can hold it for like 1 or 2 seconds, but not like yoga where you hold a certain movement. It's all done
Okay.
super slow, relaxing. So no form is like really held for certain position. So you
Oh,
keep going, and it's like a dance, like a dance, like
yes.
where you
Yeah.
have all the steps in a sequence. So if you actually see the Tai Chi movement forms, it's like the flow is like dance steps, in a very sequential way, where you from far you will feel like you're dancing. You see somebody dancing, but when it is
Right.
actually so relaxing and slow
In
movement.
a slow manner. Yeah.
Yeah, yeah.
Yeah. Wonderful. And what are some low impact cardio exercises suitable for individuals with joint issues? I want to take this one. So, low impact, when you talk about cardio, generally we think of treadmill, a recumbent bike, or bicycle, or any of, stepper. These are all primary types of cardio exercises. Running is a good example of cardio. But there are two different things very important, especially with joint issues. You need to know this because there are two different types of movements: open chain and closed kinetic chain. So open kinetic and closed kinetic chain. So open kinetic is any activity your foot is lifted up from the ground and touching the ground again, like running, jogging, walking. All these are open kinetic because your foot is lifted up from the platform. When you're doing a stepper, it's also you're lifting your foot up and putting it on the higher step. So those are open kinetic. So closed kinetic chain exercises are anything that your foot is still on the pedal, like a bicycle, elliptical. So your foot is going to stay on the pedal, and that is closed kinetic and low impact on your joint. So yeah, actually, swimming is a best exercise for joint issues because of buoyancy. Your body, you feel like you're lifted up. You feel less weight and joint, less impact on your joints. If you can't go swimming, I know a lot of people can't go swimming for so many reasons. It can be, allergic reactions to the skin, or some people, especially we are talking about elderly people, they may have incontinence or wounds. You can't go to swimming or, aquatic therapy. So in such cases, I would highly recommend trying elliptical or any pedal exercise. Like, there are some cheaper like you don't have to buy an expensive recumbent bike. On Amazon you can find $150 pedaler, so you can put your foot on the pedal and just move it like in, circles. So those are the things I would highly recommend for people with joint issues, especially closed kinetic chain exercises, not open kinetic.
I just want to quickly say something here, Raj.
Sure.
So the pedal exercises that you're talking about on Amazon, right? That's one of the best equipments that I find people using even while watching TV. like 5 to
Yeah.
10 minutes chatting with your friend, chatting with your family member, or just watching TV, 5 to 10 minutes
Yes.
just goes by so fast. And then you can
Yep.
choose to do like 3 times a day, and that itself is like 15 to 30 minutes right there. If you do it 3 times, and very low impact, and you can get your exercise going
Cardio
without
exercise.
much,
Yep.
yeah, without much
Yeah.
stress.
Yeah, great. Thank you, Swati.
Mhm.
And I think that's it for today. We planned for a 20-minute session, and we hit the 20-minute mark. Thank you very much, Swati. Appreciate your time
Yeah.
and efforts, and hope these sessions are helping. And we will continue to do it every Wednesday. The timing might change because we are trying different things to see what time is working for most people, because we have people from so many different countries. So we will continue to try different things. Again, thank you so much for all your patience, and hope we will do some helpful work here coming live. Thank you very much.
Thank you
Have a
all for
good
your
one,
time.
everyone.
Signing off. Bye.
Bye.